Hello and welcome to an episode where we will discuss the question of inclusion of persons with disabilities. So, today we are going to specifically discuss the way forward and recommendation about the inclusion of disabled. I am Professor Archana Dasi, a social work professional for the last 30 years with specialization in gender, disability and marginalized communities. I have been teaching in the Department of Social Work, Jamia Millia Islamia, New Delhi, and also actively working with a number of government and non-government organizations. So, let us start today's episode by outlining the objectives of the lesson, which include disability as a global concern, disabling barriers and its effect on the disabled person, and is a part of human condition. Almost everyone will be temporarily or permanently impaired at some point in life, and those who survive to old age will experience increasing difficulties in disability. So, disability is complex and the interventions required to overcome disability disadvantage are multiple, systemic and will vary depending on the context. Now, United Nations Conventions on the Rights of Persons with Disability, adopted in 2006, aims to promote, protect and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities and to promote respect for their inherent dignity. It reflects the major shift in global understanding and responses towards the disability. The World Report on Disability has assembled the best available scientific information on disability so as to understand and help improve the lives of people with disabilities and facilitate the implementation of the CRPD. Now, what do we know about people with disabilities? So, higher estimates of prevalence, more than 1 billion people are estimated to live with some form or other, about 15% of the world's population based on 2010 global population estimates. According to the World Health Survey, around 785 million persons 15 years and older live with a disability, while the estimated figure of around 975 million persons. Of these, the World Health Survey estimates that 110 million persons have very significant disabilities, while the global burden of disease estimates that 190 million have severe disability. The equivalent of disability inferred for conditions such as quadriplegia, severe depression or blindness. Only the global burden of disease measures childhood disability, that is 0 to 14 years, which is estimated to be 95 million children, of which 13 million children have severe disability. Now, we have diverse experiences. The experience resulting from the interaction structure and varies greatly. While disability correlates with disadvantage, not all people with disability are equally disadvantaged. Women with disabilities experience gender discrimination as well as it is disabling. School enrollment rates also differ among impairments, with children with physical generally faring better than those with intellectual or sensory impairments. So, those most excluded from the labor market are often those with mental health difficulties or intellectual impairments. People with more severe impairments often experience greater disadvantage. Now, who are these vulnerable populations? Now, vulnerable populations disproportionately affect a disability. There is a higher disability in lower income countries than in the higher income countries. People from the poorest wealth quintile, women and older persons have a higher prevalence of disability. People who have low income are out of work, or have low educational qualifications are at an increased risk of disability. Data from selected countries show that children from poorer households and those in ethnic minority groups are at significantly higher risk of disability than other children. Now, the question comes to what are these disabling barriers? Inadequate policies and standards. The policy design does not always take into account the needs of the people with disabilities, or existing policies and standards are not enforced. Examples include a lack of clear policy of inclusive education, a lack of enforceable access standards in physical environments, and low priority accorded to all these things. Negative attitude. The beliefs and prejudices constitute when care workers cannot see past the disability. Teachers do not see the value in teaching children with disability. Employers discriminate against people with disability, and family members have low expectations of their relatives with disability. Then lack of provision of the services. People with disability are particularly vulnerable to deficiencies in services such as care and support and assistance. Problems with the service delivery. The issues such as poor coordination among services, inadequate staffing, staff competencies and training affect the quality and adequacy of the services for persons with disabilities. Then another important thing is inadequate funding. Now, resources allocated to implementing policies and plans are often inadequate. Strategy papers on poverty reduction, for example, may mention but without considering the funding. Then there is a problem of lack of accessibility built environment, which also includes public accommodations, transport systems, and information is often inaccessible. Lack of access to transport is a frequent reason for the person with the disability for being discouraged for seeking work, or he is preventing from accessing care. Even in the countries with laws on accessibility, compliance in the public buildings is often very low. So, we are actually looking for ramps, lifts and such things for accessibility. The communication needs of persons with disability are often unmet. Information is frequently unavailable in accessible formats, and some people with disabilities are unable to access information and communication technologies such as telephones and television. So, lack of consultation and involvement. Often people with disabilities are excluded from the decision making in matters directly affecting their lives. We know that they are already vulnerable people, and then we are not involving them. So, lack of data with evidence, a lack of rigorous and comparable data on and evidence on programs that work often impedes understanding and action. So, how are the lives of people with disabilities affected? Now, these contribute to the disadvantages experienced by people with disabilities, such as they have poor outcomes depending on the group and setting. Person with disability may experience greater vulnerability to preventable secondary conditions and comorbidities. Untreated mental, poor oral health, higher rates of HIV infection, higher rates of obesity and premature mortality. They have lower educational achievements. Children with disabilities are less likely to start the school than their peers without disabilities. They have lower rates of staying in school and of being promoted, as well as lower transition rates to post-school education. They are less economically active. So, people with disabilities have lower employment rates than people without disabilities. Where people with disabilities are employed, they commonly earn less than their counterparts without disabilities. They experience higher rates of poverty. So, households with a person with disability are going to have higher rates of poverty than households without disabled members. As a group and across settings, people with disabilities have worse living conditions and fewer assets. Poverty may lead to disability through malnutrition, poor care and dangerous working or living conditions. So, disability may lead to poverty through lost earnings due to lack of employment or even underemployment, and through the additional cost of living with disability, such as extra medical, housing and transport cost. So, they cannot always live independently or participate fully in community activities. So, reliance on institutional solutions, lack of community living, inaccessible transport and other public facilities and negative attitude leave people with disability dependent on others and isolated from the mainstream social, cultural and political opportunities. So, let us see some recommendations for an inclusive society. The evidence suggests that many of the people with disabilities face an unavoidable circumstances and disadvantages associated which can be overcome. The following 9 recommendations for the action are cross-cutting and guided by the more specific recommendations at the end of this lesson. Implementing the recommendations requires involving different sectors: education, labor, transport, housing, and also different actors: government, civil society organizations, which also includes professionals, the private sector and person with disabilities and also their families. So, the first recommendation is enable access to all mainstream policies, systems and services. So, people with disabilities have ordinary needs for their well-being, for economic and social security, to learn and develop skills and to live in their communities. These needs can and should be met in mainstream programs and services. Mainstreaming not only fulfills the human rights of persons with disabilities, it is also more effective. Mainstreaming is the process by which government and other stakeholders ensure that persons with disability participate equally with others in any and service intended for the general public, such as education, employment, social services, to need to be identified and removed, possibly requiring change to laws, policies, institutions and environment. So, what does this mainstreaming require? Mainstreaming requires a commitment at all levels and needs to be considered across all sectors and built into new and existing legislation, standards, policies, strategies and plans. Adopting and implementing reasonable accommodations are 2 important strategies. Mainstreaming also requires effective planning, adequate human resources and sufficient financial investment, accompanied by specific measures such as targeted programs and services to ensure that diverse needs of people with disabilities are adequately met. Now, second recommendation is invest in specific programs and services for people with disabilities. So, some people with disabilities may require access to specific measures such as support services, training. Rehabilitation includes assistive technologies such as wheelchairs, hearing aids, white canes. This improves their independence. A range of well-regulated assistance and support services in the community can meet needs for care, enabling people to live independently and to participate in the economic, social and cultural lives of their communities. They can be open to labor market opportunities also. While there is a need for more services, there is also a need for a better, more accessible, flexible, integrated and well coordinated multidisciplinary services, particularly at times of transition, such as between child and adult services. Existing programs and services need to be reviewed to assess their efficiency and make changes to improve their coverage, effectiveness and efficiency. The changes should be based on sound evidence, appropriate in terms of culture and other local context and tested locally. This is something very important in recommendation of the inclusion. The third recommendation is adopt a national disability strategy and plan of action. India has yet to make a plan of action. While we should be a part of all the development strategies and action plans, it is also recommended that a national disability strategy and plan of action be adopted. A national disability strategy sets out a consolidated and comprehensive long-term vision for improving the well-being of persons with disabilities, and it should cover both mainstream policies and also the program areas and specific services for the persons with disability. So, which means policies, programs and services, everything is required. The development, implementation and monitoring of a national strategy should bring together a broad range of stakeholders, including relevant government ministries, non-governmental organizations, professional groups, disabled people and their representative organizations, the general public and the private sector. So, you can see how many stakeholders together are working in this strategy. The strategy and action plan should be informed by a situation analysis, taking into account such factors as need for services, social and economic status, effectiveness and gaps in current services and environmental and social gaps. The strategy should establish priorities and have measurable outcomes. So, the plan of action operationalizes the strategy in short and medium terms by laying out concrete actions and timelines for implementation, defining targets, assigning responsible agencies and planning and allocating the needed resources. So, the mechanisms are needed to make it clear where the responsibility lies for coordination, decision making, regular monitoring and reporting and most important the control of resources. The fourth recommendation would be involve people with disabilities. So, people with disabilities often have unique insights about their needs and their situation. In formulating and implementing the policies, laws and services, people with disabilities should be consulted and actively involved. And this may need building and support to empower people with disabilities and advocate for their needs. When suitably developed and funded, they can also play a role in service delivery, for example, in information provision, peer support. At the individual level, persons with disability are entitled to control over their lives and therefore need to be consulted on the issues that concern them directly. Education or community living supported decision making may be necessary to enable some individuals to communicate their needs and choices. So, next recommendation is improve human resource capacity. Now, we know that we lack human resources which are meant for working with the disabled people. The attitude and the knowledge of people who are working in the disability sector, for example, in education, in caregiving, labor, law enforcement and media, they are particularly important for ensuring non-discrimination and taking care of the inclusion. Human resource can be improved through effective education, training and recruitment. A review of the knowledge and competencies of the staff in relevant areas can provide a starting point for developing appropriate measures to improve them. Relevant training on disability inclusion, which incorporates human rights principles, should be integrated into current curriculum and accreditation programs. In-service training should be provided to current practitioners providing and managing the services. So, for example, strengthening the capacity of the primary care workers and ensuring the availability of the specialist staff wherever it is required contributes to effective and affordable health care for people with disabilities. Many countries have too few staff working in the field such as in the field of special education. So, developing standards in training for different types and levels of rehabilitation personnel can assist in addressing resource gaps. There are also shortages of care workers and sign language interpreters, very important. Measures to improve staff retention may be relevant in some settings and sectors. The sixth recommendation is provide adequate funding and improve affordability. Existing public services for people with disabilities are often inadequately funded, affecting the availability and quality of such services. Adequate and sustainable funding of publicly provided services is needed to ensure that they reach all targeted beneficiaries and that good quality services are provided. contracting out service provision, fostering public-private partnerships, the PPP, notably with not-for-profit organizations, and devolving budgets to persons with disabilities for consumer-directed care can contribute to better service provision. During the development of national strategy and related action plans, the affordability and sustainability of the proposed measures should be considered and adequately funded through relevant budgets. Program costs and outcomes should be monitored and also evaluated so that more cost-effective solutions are developed and implemented. Often people with disabilities and their families have excessive out-of-pocket expenses. To improve the affordability of goods and services for people with disabilities and to offset that extra cost associated with, particularly for poor and vulnerable persons with disabilities, consideration should be given to expanding and giving the social insurance coverage, ensuring that people with disabilities have equal access to public social services, ensuring that poor and vulnerable people with disabilities benefit from poverty targeted safety net programs, and introducing fee waivers, reduced transport fares and reduced import taxes and duties on assistive technologies. So, seventh recommendation is, this is most important, increase public awareness and understanding of disability. We might do a number of things, but we need to work with the public. So, mutual respect and understanding contribute to this. Therefore, it is vital to improve public understanding about disability, confront negative perceptions and represent disability fairly. For example, education authorities should ensure that schools are inclusive and have an ethos of valuing diversity. Employers should be encouraged to accept their responsibilities toward the staff with disabilities. Collecting information on knowledge, beliefs and attitudes about what can help identify the gaps in public understanding of about the disability that can be abridged through education and public information. Governments, voluntary organizations and professional associations should consider running social marketing campaigns that change attitudes on stigmatized issues such as HIV, mental illness and leprosy. This kind of a campaign can be there for the disabled also. Involving the media is vital to the success of these campaigns and to ensure the dissemination of positive stories about the persons with disabilities and their families. And this is going to be a yeoman service for the disabled and their families. Recommendation 8, improve disability data collection. So, data is very important because that shows the gravity of the issue. Internationally, methodologies for collecting data on people with disabilities need to be developed, tested cross-culturally and applied consistently. Data need to be standardized and internationally comparable for benchmarking and monitoring progress on policies and for the implementation of the CRPD nationally and internationally. Nationally, we should be including the data on the disability regularly. Uniform definitions of disability based on the ICF can allow for internationally comparable data. Understanding the number of people with disability and their circumstances can improve the country's efforts to remove disabling situations and provide appropriate services for people with disabilities. As a first step, national population census data can be collected in line with recommendations from the UN Washington Group on Disability and the United Nations Statistical Commission. A cost-effective and efficient approach is to include disability questions or a disability module in existing sample surveys such as National Household Survey, National Survey, General Social Survey or Labour Force Survey. So, data needs to be disaggregated by population features such as age, sex, race and socioeconomic status to uncover patterns, trends and information about subgroups of persons with disabilities. Then the ninth recommendation, strengthen and support research on disability. Research is a very important tool because it helps us in the evidence-based practice. So, research is essential for increasing public understanding about issues, informing disability policy and programs, and efficiently allocating resources. Research requires focused investment in human and technical, particularly in low income and middle income countries. The critical mass of trained researchers on needs disabled people has to be built. The research skills should be strengthened in a range of disciplines, including epidemiology, disability studies and special education, economics, sociology and public policy. International learning and research opportunities linking universities in developing countries with those in high income and middle income countries can also be very useful. Now, translating recommendations into actions. Now, we recommend so many things, but how do we really translate them into action? So, to implement the recommendation, strong commitment and actions are required from a broad range of stakeholders. We have already talked about a number of stakeholders. While national governments have the most significant role, even other players are equally important roles. The following highlights some of the actions that various stakeholders can take. The government can review and revise existing legislation and policies for consistency with CRPD, review and revise the compliance and enforcement mechanisms. Government can also review mainstream and specific policy systems and services to identify the gaps and to plan actions to overcome them. Government can also develop a national strategy and action plan establishing clear lines of responsibility and mechanisms for coordination, monitoring and reporting across the sectors. Government can regulate service provision by including service standards and by monitoring and enforcing compliance. Government can allocate adequate resources to existing publicly funded services and appropriately fund the implementation of the national strategy and plan of action. Government can also adopt national and ensure compliance in new buildings, in transport and in information and communication. Government can introduce measures to ensure that people with disabilities are protected from poverty and benefit adequately from mainstream poverty alleviation programs. Government has to include in national data collection systems and provide disability disaggregated data wherever possible. Implement communication campaigns to increase public knowledge and understanding of disability. Establish channels for people with disabilities and third parties to lodge complaints on human rights issues and laws that are not implemented or enforced. They support people with the disabilities to become aware of their rights, to live independently and develop their skills. Support children with disabilities and their families to ensure inclusion in education. Represent the views of their constituency to international, national and local decision makers and service providers and advocate for their rights. Contribute to the evaluation and monitoring of services and collaborate with researchers to support applied research that can contribute to service development. Promote public awareness and understanding by professionals about the rights of persons with disabilities. For example, through campaign, advocacy and equality training. Conduct audits of environments, transports and other systems and services to promote the barrier removal. Now, what can service providers do? Carry out access audits in partnership with local groups, identify physical and information that may exclude persons with disability, ensure that staff are adequately trained about implementing training as required and including service users in developing and delivering the training. Develop individual service plans in consultation with disabled people and their families wherever it is necessary. Introduce case management, referral systems and electronic record keeping to coordinate and integrate service provision. Ensure that people with disabilities are informed of their rights and the mechanism for the complaints. Now, what can academic institutions do? Remove barriers in the recruitment of students, staff who are with disabilities. Ensure that professional training courses include adequate information about disability based on human rights principles. Conduct research on the lives of persons with disability and on disabling environment in consultation with the private sector. Now, what can the private sector do? Promote diversity and inclusion in working environments. Facilitate employment of persons with disabilities. Ensure that recruitment is equitable, that reasonable accommodations are provided, and that employees who become disabled, they are supported to return to work. Something very important, because this would be a part of the rehabilitation process also. Remove access to microfinance so that persons with disability can develop their own businesses. Develop a range of quality support services for persons with disability and their families at different stages of the life cycle. Ensure that construction projects such as public accommodations, offices and housing, they have adequate access for persons with disability. Ensure that ICT products, systems and services are accessible to persons with disabilities. So, what can the communities do where disabled people are living? Challenge and improve their own beliefs and attitudes. Protect the rights of the persons with disabilities. Promote the inclusion and of the disabled people in their community. Ensure that community environments are accessible for people with disability, including schools, recreational areas and cultural facilities. Challenge violence against and bullying of persons with disability. Now, another stakeholder is people with disabilities and their families. Support other people with disability through peer support, training, information and advice. Promote the rights of persons with disabilities within their local communities, for example, by conducting access audits, delivering equality training and campaigning for human rights. Become involved in awareness raising and social marketing campaigns. They can also participate in various forums. It could be international forums, national forums or local forums to determine the priorities for change, to influence the policy and to shape service delivery. And last is participate in research projects. This is all we have for you today. We shall see you again with another interesting episode. Till then, take care and goodbye.